In this edition of Health Matters, we'll learn about the amazing benefits of IV vitamin therapies, illustrate the dangers of driving drowsy, visit a convenient place to go for urgent care, and explore unhealthy habits you might be doing while you sleep. We're at Metabolix Wellness to find out the truth about IV vitamin therapies. Describe the process of IV therapy.
IV vitamin therapy, it's a very comfortable process. Patients will come in, they'll sit in one of our recliners, they'll get just a small needle and an IV catheter inserted into a vein in their arm, and then they'll receive an infusion of vitamins and minerals, and usually it's a saline solution. It's dependent on yes, their diagnosis. We have doctor-formulated protocols that we do infuse, but generally it's what we call our wellness IV, which most people get.
Who are the best candidates for this type of IV therapy?
Everybody's a candidate for IV therapy. People who are healthy and feeling well do well getting regular IV infusions, as well as patients with chronic conditions. We see a lot of patients who have Crohn's disease, celiac disease, colitis, because they get the nutrients infused. It doesn't have to go through their digestive system to get the full benefit. We also see patients who have autoimmune diseases, patients with chronic fatigue and fibromyalgia, as well as patients who are trying to optimize their health, such as we can see a lot of athletes as well who get IVs before big performances.
So how long does an IV therapy session generally take?
The whole process probably takes about an hour, but it actually depends on how much solution they're being given. If they're just getting an IV push, which is just a small amount of solution, it can be as quick as 15 minutes. But most patients who get the full IV takes about an hour.
And what are the various concoctions that a patient might receive?
We have one IV in particular that we use when people are stressed. It has magnesium in it, it has GABA and other amino acids that help to relax the body. And often these amino acids and minerals become depleted in people who have chronic stress. We actually have patients who come in after a late night out. They call it the hangover IV. It gives them the vitamins and the hydration they need or have depleted maybe the night before. So we will get a lot of people who come in for that as well. I like how Dr. Agan puts it. He says that a multivitamin has a little bit of everything but not enough of anything. And oftentimes when people take multivitamins, it has to go through their stomach, their digestive system, and their intestines to be absorbed. So it's called the first pass effect, where it's not totally 100% absorbed. When you're giving vitamins and minerals through an IV, it has 100% absorption because it doesn't have to go through the digestive system.
The neat thing is, in our experience being in the clinical setting where we administer IVs, I mean, as Jamie said, we have a lot of different types of patients that come in for IV therapies. And the biggest thing that anyone out there that needs to know as far as a controversy if IV therapies are good for you or if they work or if they're a waste of money is to really look at the clinical conditions that we're using them for. It doesn't matter if it's for performance, for someone that's training for a triathlon. These guys know their body, they know their times, they do this is a very important aspect of their lives. They know what works for them to beat their best times and what doesn't. And in our performance IVs, you know, that we do a series of them before people go into these races, when they're done, they're astounded as far as what actually is happening. I mean, these people are beating their best times even in their practice runs. And so far, any of our Ironman competitors or triathletes have all beaten their personal best times that have done our nutritional therapies. So, I mean, these guys know. They're taking vitamins, they're taking supplements. They know what works and what doesn't work because they run these races year in and year out. And then you talk about medical conditions. You know, I wish some of these shows that talk about IV therapies would bring some clients up there or patients up there that have utilized IV therapy. You know, Jamie mentioned Crohn's disease. You know, we've had some ex-football players that played in the NFL that had Crohn's and had to cut their season, their whole career short. But if they were able to get nutrient IVs through their career, pre-game or after games or during their career, they would have been able to extend their actual playing. And we have people that have cancer. We treat kids with autism. Again, these are people that go through traditional medicine and they go through natural medicine, but they know anything that works, anything that makes them feel better, they're not going to forget that. They're going to know, they're going to stick with what works. And when you give people IV therapy and they come back and say, you know what, I don't have to take as many pain pills. I can actually get up and move. If they want to say that's all placebo, they can, but if it was placebo, these other things would be working just as well. And so it's a very important process for some of these people that have these chronic conditions. So a lot of the different doctors out there that are talking about, well, maybe it's a waste, it's not working, you don't need that type of vitamin therapy. They really need to try it in a clinical setting or come in and actually sit and talk to patients. And I think they're going to get a different perspective on how nutrient or IV therapies can work for people. We know we're not getting enough fruits and vegetables. We know we're not eating as well as we should. We're fast-paced, we're moving a lot more than we are in the gym. These things can help replenish some of those micronutrients that the body needs.
Health Matters will be right back.